Removing testicles from men is called castration, and they are called eunuchs. But what do you call women who've had their ovaries removed? That is still a castration procedure, but there is no word for a female eunuch. So the vast majority of ovaries are removed prophylactically, and they're done during hysterectomy. And hysterectomy's rate has not changed since I was in OBGYN school. So I started my residency in 1986, and there was about 650,000 hysterectomies done in the U.S. each year. And in 2005, there was 621,000 hysterectomies done. The vast majority are done for abnormal bleeding, and the uterus pathologically is normal. The other common indication is for fibroids. Well, 75% of women have fibroids, so you can make an argument that having fibroids in your uterus is normal. If they're symptomatic and causing difficulty, that's a different story. But we found fibroids on ultrasound all the time that were clinically irrelevant. They were just there, and they're benign. Very rare for them to turn into a cancer of the uterus. I spent 30 years trying to talk women out of having hysterectomy because I thought there were some ramifications. Specifically, if the cervix was removed, which is true usually, and future pelvic floor prolapse and pelvic support problems. And then removing ovaries, me being a hormone doctor, seemed like an idiotic idea. You were putting women in premature menopause many years before that they would naturally go through menopause, and there are some cardiac risk factors associated with that. So informed consent prior to hysterectomy is kind of rare. Most women are told, all of your problems will go away and everything will be great. And for a lot of women, nothing could be further from the truth. I'm going to do a deep dive into the history of hysterectomy, why it's done, the approaches used for that. The most common approach is the most difficult to recover from, but easiest for the surgeon, and they get paid better for doing an easier surgery. So we'll do that on the app, the Health Without Risk app, where I can discuss things free from oversight by CEOs of social media companies that like to censor people. I got in trouble on a couple other platforms for saying words from gynecology. So I'm going to do this on the app. I'm the moderator. I'm not going to censor myself. And we'll do a series of videos on the history of hysterectomy and the ramifications of said procedure that should be up. The first parts should be up next week. You can sign up for the app at the link that's at the bottom of this page. You'll have to copy and paste it. Create a username and a password, then go to the App Store, and for Android or iPhone, you can download the Health Without Risk app and sign into it using your username and password. On that app, lots of articles. I have quotes of the day, videos. I have videos that are categorized for you, and some fitness workouts, and even some recipes that I've made and I've acquired from other chefs and other cooks on other platforms. Specifically looking at low carb and ketogenic eating, which can be pretty yummy and tasty if you do it right. So join me on the app. It's a community where we discuss whatever we want without oversight or people picking on us. And we'll discuss hysterectomy and why doing that might not be in your best interest if you're considering a hysterectomy. Have a great rest of your day, and I'll talk to you soon. Bye.